good morning to all. Welcome to Emergency and Trauma Department Hospital Kuala Lumpur Basic Point of Care Ultrasound in Emergency Lecture Series. We will start off with essential physics of ultrasound and knobology. Obviously, physics is not a huge interesting topic pertaining to ultrasound, but it's quite fascinating to think about how the image is generated, and to understand that, understanding the physics behind it is of great help. The objectives of this lecture is to provide an insight into ultrasound machine and the physics behind it while learning the correct technique of standard image acquisition and understand the image interpretation. We would be covering on properties of sound and ultrasound, ultrasound waves formation, and what happens to this wave when it interacts with the tissues, ultrasound knobology, types of common artifacts, and image optimization. Moving on to properties of sound and ultrasound. Sound is created by vibration of moving objects producing mechanical waves. And these waves are made up of compressions and rarefactions of molecules in a medium. Another important property of sound is that it travels in straight line. What about ultrasound? It is not different from normal audible sound in its physical properties except that human cannot hear it. The ultrasound for medical diagnosis uses frequencies between 2 to 15 MHz, unlike the audible frequencies of a human, which ranges from 20 Hz to 20 kHz. When we talk about physical properties of sound or ultrasound, we need to know what is a cycle, what is a frequency, what is a wavelength, amplitude, and what is the speed of sound. A cycle is one complete path traveled by the wave, and the time taken to complete this one cycle is called a period. Whereas frequency is number of cycles repeated in 1 second, and the units given for frequency is Hertz. It's important to remember that higher frequency have better resolution, and due to its short wavelength, it has poor penetration. And this explains why deeper structures are best visualized using lower frequency and superficial structures are best visualized using higher frequency. Wavelength is the distance between two similar points on the wave, and it is measured in millimeter. Do remember that wavelength is inversely proportional to frequency. In other words, higher frequency has shorter wavelength and lower frequency have broader wavelength. What about amplitude? Amplitude is the peak of the wave. Amplitude equates to intensity or power of the wave, and it is expressed as decibels. The amplitude is such that it decreases as sound propagates through the body, and it is called attenuation of the wave. All sound, regardless of the frequency, travels at the same speed through a medium. To give an example is an orchestra, whereby different instruments produces different frequencies, but all of these frequencies travel through the hall at exactly the same speed. So what actually alters the velocity of the sound? It's actually the medium the sound traveling. As shown in this table, sound travels the fastest in bones and slowest in air. And this difference is the principle behind sound refraction creating artifacts. Moving on to how ultrasound waves are produced. The probe acts as a sender and receiver. The electrical charge is applied to the piezoelectric crystal in the probe, causing it to vibrate, producing sound wave. And this sound wave then travels through the tissue, where some of it are reflected back to the probe. The reflected echoes is then converted into the electrical signal by the same piezoelectric crystals before projecting it as an image. In the past decades, transducer assembly has evolved in design and function. This is a cross-section of a transducer used in current era, and I must say that the most important layer is the piezoelectric crystal layer, which cannot emit a second pulse until the first has returned to the transducer. Image resolution is the details an image holds, and we are often obsessed with image resolution. Both axial resolution and lateral resolution comes under the same umbrella of spatial resolution. And another aspect is temporal resolution. Axial resolution is the ability to differentiate between two separate structures parallel to the ultrasound beam. And as shown here, higher frequency has better resolution compared to a lower frequency. What about lateral resolution? It's the opposite of axial resolution, whereby it's the ability to differentiate between two structures perpendicular to the ultrasound beam. And lateral resolution is determined by both ultrasound frequency as well as beam width. Narrow beam width has the best lateral resolution. How to improve lateral resolution? Is by taking advantage of the focus point. What is a focus point? It is the narrow point present in the ultrasound beam, and this point has the greatest lateral resolution. The position of focus point can be adjusted to area of interest, and the number of focus points can be increased. Temporal resolution comes into interest when we image moving structures like the heart. It is the ability to accurately locate the position of a moving structure at a particular time. Temporal resolution is determined by frame rate. As shown in the image, the leftmost is of frame rate 34, followed by frame rate 56 and 112. Low frame rate produces grainy appearance, whereas too much of a frame rate produces blurry and smeared image. Ultrasound wave undergoes changes in the tissue. These changes are the principle of most artifacts production. These waves get attenuated, reflected, and refracted. Attenuation means decrease in wave amplitude as it propagates the tissue, and attenuation occurs greatest in the air, followed by bone, soft tissue, and water. Attenuation occurs by sound wave absorption and dispersion. Tissues absorb acoustic energy and convert it to heat. This is the major source of attenuation, making the waves difficult to reach deep structures. So how to overcome this? Is by using the TGC or time gain compensation. It is a setting present in ultrasound machine that increases the received signal intensity from deeper structures, making it look equally echogenic. Acoustic impedance is an important ultrasound property of any tissue. It is the resistance to propagation of sound through a medium. This effect becomes noticeable at interfaces between different tissue types where, if the difference is large, the sound waves either get reflected or refracted, producing mirror image artifact. The acoustic impedance of a bone is the highest, followed by soft tissue and air. As shown in this image, due to the large difference of acoustic impedance between the liver and the air in the lung, it produces a mirror image artifact of the liver above the diaphragm as a result of sound wave reflection. The waves which are not attenuated will be reflected back to the probe, producing the image. The amount of reflected beams are determined by the surface of the reflector. If the beam strikes the tissue surface perpendicularly, more beams are reflected back to the probe. If the ultrasound beam encounters an irregular surface, it causes scattering of the waves. And if the beam encounters a large smooth surface, the waves will get reflected in specular fashion. Besides attenuation and reflection, ultrasound waves are refracted when passing from one tissue to another of different speed of sound and acoustic impedance. This is the principle of double image artifacts. This is the summary of ultrasound interaction in the tissue. To recall, these waves undergo attenuation, reflection, and refraction, and acoustic impedance plays a huge part behind its occurrence. Moving on to ultrasound knobology, there are numerous brands of ultrasound machine with different layout of ultrasound platform. Most of the machine displays some common knobology. This is an example of a platform consisting of various knobs and buttons. We have the power button to on and off the system. This button may also offer options of putting the system into sleep mode or standby mode. The patient button to enter patient's details or the operator's details. The exam button to select the transducer. The brightness mode button, some machines call it as 2D mode button. The motion mode button. The Doppler mode button. The color Doppler. The gain knob. The depth knob to increase or reduce the size of the image. The freeze button. The store button to store the images as well as the ultrasound clips. The trackball to move around the cursor. The TGC and the caliper button. There are four common transducers. They are curved array, linear array, phased array, and microconvex array transducer. The curved array transducer has a low frequency of 2 to 5 MHz and it produces a wide fan-shaped beams. And this beam has high penetration but low resolution. The linear array transducer has a higher frequency of 6 to 15 MHz and this produces a regular linear beam which has good resolution but poor penetration. Phased array transducer has a frequency of 1 to 5 MHz and it produces a pie-like beam or a sector image. Phased array transducer is a bit unique because it has good penetration as well as high resolution, and this is because of the presence of multiple small elements of each of which is pulsed individually at a calculated timing. The microconvex array transducer has a frequency of 2 to 5 MHz, which is similar to the curved array transducer, and it produces a narrow fan-shaped beam. It has good penetration, however, low resolution. Talking about the probe, one should not forget about the probe marker. The probe marker will be present at the side of the transducer, marked as a notch, a dot, colored line, or a light indicator. This marker eases the orientation of the patient's anatomy in relation to the marker displayed on the ultrasound screen. And this marker should always be pointing towards patient's right or cranium. We have three types of ultrasound mode, which is B mode, M mode, and D mode. B mode, also known as brightness mode, and it is a 2D image represented by different shades of grey. These different shades of grey are converted from amplitude waveforms. How about M mode? M mode and B mode are often displayed together. In this mode, the pulses of ultrasound record motion of the tissue at the area of interest indicated by the line or a marker, and this motion is displayed over a time axis. This mode only captures the returning echo in only one line. Hence, the marker has to be kept at the area of interest to capture the motion. D mode or Doppler mode relies on the principle of Doppler shift, which is a difference between transmitted and received frequency. This mode shows blood flow and blood direction. As depicted in this image, if the sound source represented by the ambulance with the siren moves towards the receiver, the sound gets squeezed, producing a high frequency or a high-pitched sound represented as a positive Doppler shift coded as a red. And if the siren moves away from the receiver, the sound gets stretched, producing a low-pitched sound or a low frequency, making a negative Doppler shift, usually coded as blue. These are examples of color Doppler. The one on the left shows a case of aortic regurgitation and the one on the right shows neck vessels. Positive Doppler shift is coded as red, whereas negative Doppler shift is coded as blue, and the color scale can be altered manually. Putting all the information from the first part of the lecture, from here on we will talk on some common ultrasonographic artifacts. What is an artifact? It is a structure in an image which does not correspond to the actual tissue being scanned. It can either be structures in the image that are not actually present, structures that should be represented but missing from the image, or structures that are misregistered. There are a total of 24 types of ultrasonographic artifacts. However, we would be covering only on a few common ones. They can be divided into propagation group and attenuation group. In propagation group, it consists of reverberation, comet tail, ring down, mirror image, refraction, and edge artifact. In attenuation group, we have shadowing as well as enhancement. Reverberation is one of the commonest artifacts seen in ultrasonography. It occurs when the beam encounters two strong parallel reflectors. This is an image of lung ultrasound showing A lines, which are a form of reverberation artifact. The ultrasound beam reflects between the transducer phase and the pleura, and this occurs in repeated fashion, and the delay in echo reception is then perceived as different depth which explains why A lines are equidistant. The image on the left shows the reverberation in the urinary bladder caused by the bowel gas present anterior to the bladder, and the image on the right shows reverberation artifacts in a case of pneumoperitoneum. Hence, reverberation artifacts can either be a normal finding or an abnormal finding. And how to minimize reverberation is by changing the angle of insonation or plane of imaging. Comet tail artifact is a subset of reverberation artifact where the multiple reflections occur within the structure instead of the transducer tissue interface seen in reverberation. This is an example of a comet tail artifact occurring in the interface of pleura and diaphragm. In comparison to reverberation, comet tail artifact is shorter in length and tapers with depth. The image on the left shows a comet tail artifact in the gallbladder, whereas the image on the right shows comet tail artifact below the pleural line. How to rectify this? This can be rectified by changing the angle of insonation and reducing the TGC. Ring-down artifacts seen in association with air bubbles. Interaction of the beam with the air bubbles result in a continuous wave of sound transmitted back to the transducer. The image on the left shows a ring-down artifact in a case of pneumobilia, and the image on the right shows a ring-down artifact in a case of pneumoperitoneum. The next artifact is mirror image artifact. This is due to reflection of the waves at the large smooth interface whenever there is a huge acoustic mismatch. As shown in this image, due to the large difference in acoustic impedance between the soft tissue and the air in the lung, the ultrasound wave reflects off the diaphragm, hitting the target structure, in this case a hepatic hemangioma, before reflecting back to the transducer. And due to the increased time to echo return, the mirror image of the hepatic hemangioma appears to be deeper. The example on the left shows a mirror image artifact of the liver above the diaphragm, and the example on the right shows a mirror image artifact of a beating heart. Mirror image artifact can be minimized by decreasing the gain and changing the angle of insonation. Refraction occurs when the waves travel through mediums with different speed of sound at a non-perpendicular angle of incidence. This image shows ghosting artifact of the abdominal aorta, which appears in duplicate deep to the rectus abdominis muscle, which acts as a refractor. This is another example of refraction showing misregistration of the aortic valve. This artifact can be minimized by changing the angle of insonation. Edge artifact is a type of refraction artifact occurring at the edge of a cyst, which has a different speed of sound comparing to the surrounding structures. And this can be rectified by changing the angle of insonation. We are done with propagating artifacts. Now we move on to attenuating artifacts. Acoustic shadowing occurs when the ultrasound beam passes through tissues of different acoustic impedance, appearing as an area of low amplitude echoes behind an area of strongly attenuating tissue. This is an image showing hyperechoic gallstone with clean posterior acoustic shadowing, whereby the gallstone acts as a strong ultrasound beam reflector. Acoustic enhancement is the exact opposite of acoustic shadowing. This phenomenon occurs only in fluid-containing structures, whereby the ultrasound waves are least attenuated in fluid, hence allowing more beams traveling through it. As the saying goes, fluid is a good friend of ultrasound. The image here shows an acoustic enhancement posterior to the urinary bladder. Coming to the last part of this lecture would be some basic tricks to optimize ultrasound image. There are a number of basic tools to optimize the sonographic image. They are frequency, depth, gain, and focus point. Firstly is choose the right transducer for the imaging. Use high frequency for superficial structures for better resolution and low frequency for deeper structures due to deep penetration. And then manipulate the depth of the image of interest. Reducing the depth shortens the amount of time the machine listens to returning echoes and vice versa. So start with a higher depth and then decrease to an area of interest 3/4 depth of the screen. Subsequently, have optimal gain. Gain changes the overall image brightness by adjusting the amplification of the electronic signals after the echoes have returned to the transducers. Evidenced by these images, less gain and too much gain may obscure some important sonographic details. As mentioned earlier, TGC can also be adjusted to the area of interest for a more equal echogenicity. Lastly is take advantage of the focal zones. As we have learned earlier, focal point is a narrower segment of an ultrasound beam with highest lateral resolution. This focal point indicator is present at the side of the screen, and the position of the focal point can be changed to the area of interest to achieve better image resolution. Besides changing the position, focal point can also be increased more than one, but always keep in mind that not to increase too much as it can backfire and reduce the image resolution. We have come to the end of this lecture. Do remember that understanding the physics behind sonographic imaging enables standard image acquisition and correct image interpretation.